My name is Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. It's Thursday, April 30th, 2026. What I thought we could talk about today was something that's happened over the last couple weeks, which is that the Centers for Disease Control has decided initially to pause and then basically to cancel the publication of a study that looked at the effectiveness of COVID vaccine over the past year. Now, they were going to publish it in their journal, Morbidity and Mortality Weekly Report, but decided not to do that. What that study showed was that the vaccine was about 50% effective at preventing urgent care visits and 55% effective at preventing hospitalizations from COVID. Now, the reason that the CDC said that they didn't want to publish it, and this is specifically Jay Bhattacharya, who is the interim director of the CDC, was that they said that the methodology used to determine effectiveness was flawed. Now, the methodology that was used was something called test negative design. It's commonly used to detect the effectiveness of vaccines against rotavirus or COVID or influenza. In fact, the CDC just published a study a month ago using the same test negative design, looking at the effectiveness of the influenza vaccine. The New England Journal of Medicine published a paper in 2021 looking at the effectiveness of the influenza vaccine, also using a test negative design. And that same methodology has been used to publish papers in the Journal of the American Medical Association, The Lancet, and other peer-reviewed excellent journals. One can only conclude that the reason that this study was held back and then ultimately canceled was that it shows that the COVID vaccine is effective, and this administration, under the leadership of Robert F. Kennedy Jr., who has said he thinks that the COVID vaccine was the most dangerous vaccine ever made, they don't want you to know that. They just don't want you to know that this vaccine over the past year was effective. It's ironic when Robert F. Kennedy Jr. took his position as Secretary of Health and Human Services, he said he was going to usher in an era of radical transparency. This isn't that. It's also ironic that both Jay Bhattacharya and Robert F. Kennedy Jr. and others said that they think parents need to be fully informed before they make a decision about vaccines, yet proceed to do something that only doesn't inform them, or at least doesn't inform them as much. So I think that's disappointing. The good news is that that paper leaked out. It's been published in Substacks, and now the media has it because I've been called by the media about that paper. So it did get out, but it is sad to see that the administration would be willing to hide information that parents can use to help them truly make informed decisions. Thank you.